So traditional treatment is done in sequential steps. The first step is to reduce inflammation. So normally when you have a kid like that with the swelling on the ankle, you're just going to try and get rid of that swelling. And so you're going to spend the time it takes to get rid of that swelling. That takes time. The next thing you're going to do is try and restore range of motion. Okay, so you want to get that ankle moving decently so that you can then start to strengthen the ankle. Okay, and so each one of these phases, you know, a basic time for an injury that actually somebody wants to go to a rehabilitation situation for, each one of these phases is roughly around 1 to 2 weeks. Okay, so this is several weeks' time to get through all of this. And then the last phase is restoring function. And so that would be, you know, getting on some type of like a unstable surface or doing single leg stands, and then actually starting to move, and then starting to put the foot in the dirt and propel themselves forward. And so that can take a number of weeks. Common time frame for a sprain is going to be 4 weeks for a mild sprain, 6 weeks for a more severe sprain. And that's to where the person actually starts doing some kind of training again. So this kid, the one that you saw in there, 7 days later was doing full-out sprints, agility drills, and went to his first basketball practice from when he got his injury the week before, and actually qualified as a starter for his team. So that's a whole lot faster than normal. So the reason, if you want to put this and make this whole thing simple, and I'll say that we can go off in all kinds of different tangents once we get going into this therapeutic system, but to keep things really simple, it's taking these sequential steps and reducing them down into a single step. And that's a product of the methods and the technology that we use.